Liposuction has a history of being extraordinarily safe. However, there are cases that you read about in magazines and newspapers of problems with liposuction. So everything is centered, especially when you're a board-certified plastic surgeon, around safety. Safety is the whole point. And with patients being concerned about safety, liposuction being one of the most common procedures, we talk about this regularly. Number one, the amount you remove has to be limited based on safety. If we take over 5 liters, which you can imagine is a lot of fatty tissue, but many people, when you do several areas, can reach that volume, dramatic results, we wind up keeping people overnight in a surgical hospital to monitor their fluid output and monitor their vital signs. And that's a society recommendation that we take to heart. Most patients don't have that much tissue removed, but many do. And so that's the most important thing, is doing the surgery in an environment that is safe. We use only board-certified MD anesthesiologists, and I feel that gives the patient the safest opportunity to be taken care of. We're very careful with how much fluid we infuse, the tumescent fluid that we've talked about previously, which we use to prepare the fat. And we're very careful about how much lidocaine is given. So after those safety issues are taken care of, and the patient's been evaluated for health and all those things you would do normally as a diligent physician, then you look at what are the risks of the actual surgery. Bleeding is very rare. Infection is very rare because antibiotics are given. And the biggest complication is just simply not reaching the patient's expectations. And that just is simply talking ahead of time about what the expectations can be and what the limitations of the surgery are. And that pretty much relates to skin tone. And finally, the most dreaded complication is irregularities or indentations that can occur from uneven fat removal. It's not common. Subtle little areas may happen, but those are fixable. And so that's the one area that again relates to skin tone, as far as the surface of the skin looking smooth after surgery. And that's one that can clearly be avoided by discussion and by technique.